Financial advocates play an incredibly important role in this process, and a lot of it has to do with bringing to the table a set of knowledge that they can really apply to help patients to understand what resources are available for them, to help them prepare for costs, and to act as a liaison between the clinician and the patient, such that the clinician can really help in terms of making appropriate clinical decisions, and then the financial advocate can help in assisting the patient afford those treatments. I think that affordability discussion should happen early. I'm not completely sure yet who should be having that discussion, whether the clinician should have the discussion or whether a financial advocate should have the discussion first. But what I do know is, as a clinician, my responsibility is to make sure that my patient can tolerate their treatment, both from a physical perspective and from a financial perspective. And so in my practice, I will often ask patients simple questions like, are you able to afford your treatment? And if they say no, I then direct them to our financial care counselors. So I think that that conversation needs to happen not just early, but often. So I think more and more patients understand that cost has to be a part of their decision making if they want to stay on their treatment and be able to afford it. The trick comes in how that conversation is couched. And so for me, I am very careful to let patients understand that I am asking this question not because I'm interested in reimbursement, or even at that moment, not because I'm interested in the overall economic well-being of the health system. But what I'm interested in is how to help the patient in front of me afford their care, afford the care that I think is the best for them. And that's how I couch that discussion, to make it as easy as possible for the patient, to remove all risk of embarrassment or misunderstanding on the part of the patient.